This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has opened the door to partnerships with industry, trade associations, nonprofits, and advocacy groups. More than 50 medical schools have committed to expand nutrition education from an average of 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry has committed to phase out petroleum-based dyes by the end of the year, and many have already eliminated them.
Welcome back to the channel. Hit that like button, subscribe, and God bless every one of you standing for truth, freedom, and America. Today, we're reacting to RFK Jr. urging Congress to codify what he calls lasting generational reform in American healthcare and nutrition. And I got to tell you right from the start, this is one of those moments where the political lines don't fit neatly into the old boxes. Because here you have RFK Jr. serving in President Trump's administration, standing before Congress, and saying something that millions of American parents, grandparents, veterans, and working families already know deep down. America is not healthy, our healthcare system is broken, and Washington cannot keep pretending that everything is fine. Now, as a right-wing patriot, my first reaction is this: good. Finally, somebody is talking about root causes. For too long, Washington's answer to every health crisis has been more spending, more programs, more bureaucracy, more pills, more paperwork, and more power for the same agencies that helped create this mess in the first place. But look around. Are Americans healthier? Are our kids stronger? Are our families paying less? Are seniors more secure? Are working people getting real relief? No. We have one of the most expensive healthcare systems in the world, and yet regular Americans are still dealing with chronic disease, rising costs, confusing insurance networks, drug prices that make no sense, and a food system that too often puts profit over health. So when RFK Jr. says Congress needs to codify reform, I agree with the principle. Because if this is real reform, it cannot just be another speech. It cannot just be another press conference. It cannot be another temporary executive action that disappears the moment the next administration walks in. Congress needs to put real, durable America First healthcare reform into law. But here's where I'm going to be very clear. Reform does not mean giving the federal government unlimited power over your doctor, your family, your food, or your choices. That's not conservative. That's not constitutional. And that's not freedom. Real reform means transparency. It means accountability. It means breaking up the cozy relationship between Big Pharma, Big Food, insurance giants, hospital systems, lobbyists, and bureaucrats. It means asking why the American people keep paying more, getting less, and being told to shut up and trust the experts. We trusted the experts for decades, and what did we get? We got a system where Americans are over-medicated, overcharged, and overwhelmed. We got kids surrounded by ultra-processed food. We got parents trying to read ingredient labels that look like chemistry experiments. We got seniors choosing between groceries and prescriptions. We got veterans stuck in medical red tape. And we got politicians giving speeches about compassion while taking campaign money from the industries benefiting from the chaos. That is why this moment matters. RFK Jr. is saying healthcare and nutrition reform must be generational. That word matters, generational. Because the damage was not created overnight, and it will not be fixed overnight. This country needs a long-term health reset. But patriots, I also want to be fair. Congress has a real role here. We do not live under rule by cabinet secretary. We do not live under rule by expert panel. We do not live under rule by permanent bureaucracy. We live...
Mr. Secretary, we turn it over to you for your opening statement.
Chairman Crapo, thank you. Ranking Member Wyden and members of the committee, thank you for the opportunity to appear before you today to discuss President Trump's proposed 2027 budget for HHS. First, I'd like to take a moment to express my deepest condolences to your colleague, Senator Mark Warner, over the recent loss of his daughter, Madison. My thoughts and prayers with him and his family. We stand at a generational turning point. Our children are the sickest generation in modern history, and decades of failed policies, captured agencies, and profit-driven systems caused it. Parents across this country demanded change, and we are delivering it. We're ending the era of federal policies that fueled the chronic disease epidemic and replacing them with policies that put the health of the American people first. President Trump and I are challenging the status quo and the institutions that defended as we work to make America healthy again. In just 15 months, HHS has delivered historic wins. We negotiated the most favored nation drug prices with 16 of the largest pharmaceutical companies so that Americans no longer pay more than other people in wealthy countries for the exact same medications. We're bringing real transparency to healthcare pricing so that patients know the cost of care before they receive it. I use the full convening power of the federal government to bring health insurance CEOs to the table to reform prior authorization, and I brought the 400 largest tech companies together to end information blocking so that for the first time Americans will be able to get their own health records, which they own, on their cell phones. We are cutting red tape, speeding decisions, and demanding transparency. We're also cracking down on waste, fraud, and abuse. This year, HHS and USDA issued new dietary guidelines that put real whole food at the center of the American plate. We flipped the food pyramid upside down and sent a clear message to the American people: eat real food. HHS has opened the door to partnerships with industry, trade associations, nonprofits, and advocacy groups. More than 50 medical schools have committed to expand nutrition education from an average of 2 hours to 40 hours. Food manufacturers are stepping up too. More than 40% of the food industry has committed to phase out petroleum-based dyes by the end of the year, and many have already eliminated them. In conjunction with these efforts, FDA approved 6 natural food colorings derived from fruits and vegetables. Through President Trump's Great American Recovery Initiative, HHS is matching compassion with action to help Americans break the cycle of addiction. At HHS, we are prioritizing patients with ultra-rare diseases and their families, driving faster access to life-saving treatments. We're restoring gold standard science and integrity across the agency. We're protecting children from sex-rejecting procedures that expose them to irreversible harms. We're eliminating outdated and misleading warning labels on hormone therapies used by women during menopause. We're strengthening oversight of organ procurement. We are regulating television advertisements for pharmaceutical industry, something the Democrats have been asking for generations. We're implementing Operation Stork Speed to ensure the safety and quality of infant formula. We're applying that same focus and urgency to rural America. The Rural Health Transformation Fund delivers the largest investment in rural health in our nation's history, $50 billion over 5 years, to strengthen rural hospitals and ensure Americans can access the care they need no matter where they live. HHS has also last week announced more than $135 million investment this month to expand rural residency programs and nutrition services. The data is clear: when physicians train in rural communities, they're far more likely to stay and serve there. The president's budget puts all these priorities in action. It invests in prevention because preventing disease costs less than treating it. As my uncle, President John F. Kennedy, said, progress is a nice word. Change is its motivator, and change has its enemies. We see those forces clearly: entrenched interests, defenders of a failing status quo, and institutions that put profits ahead of the American people. The resistance underscores the urgency of this moment. We can reverse chronic disease, improve public health, and lower costs. I stand ready to work with this committee and Congress to seize this opportunity to implement and codify lasting generational reform in American healthcare for our country, for our children, and for the health of the American people. Together, we can make America healthy again. Thank you, Mr. Chairman.
Thank you, Mr. Secretary. And
in a constitutional republic. So yes, RFK Jr. should push for reform. Yes, President Trump's administration should fight to make America healthy again. But Congress must debate it, write it clearly, fund it responsibly, and make sure the American people know exactly what is being done in their name. No secret deals. No backroom mandates. No expanding federal control under the disguise of health. Because conservatives should never fall into the trap of saying, well, our guy is in charge, so now government power is fine. No, the standard must be the same. The goal is not bigger government. The goal is better government. Smaller where possible, tougher where necessary, and always accountable to the people. Now, let's talk about nutrition. This is where I think RFK Jr. is hitting a nerve that both parties ignored for too long. For years, conservatives focused on taxes, borders, energy, crime, and foreign policy. All of that matters. But what good is a strong country if the people are sick, tired, addicted, anxious, obese, and dependent on a medical system that profits when they stay unhealthy? America first has to mean American health first too. That starts with food. Why are we allowing chemicals, additives, and processed junk to dominate the diets of children? Why do school meals too often look like corporate leftovers instead of real nutrition? Why do we subsidize sickness and then act shocked when the bill comes due? And let me say this clearly. I am not calling for government to become your parent. I am calling for government to stop protecting powerful industries from accountability. There is a big difference. If a company wants to sell food in America, the American people have a right to know what is in it. Parents have a right to understand what their kids are eating. Consumers have a right to honest labels. Taxpayers have a right to ask why federal programs keep feeding the same broken cycle. That is not socialism. That is common sense. That is America first. Now, the left will try to twist this. They'll say Trump's administration is cutting here, reorganizing there, and therefore this whole thing must be evil. The media will find one controversy, one soundbite, one bureaucrat upset about losing power, and they'll use that to distract from the bigger question. The bigger question is this: has the old system worked? No, it has not. The old system gave us rising chronic disease, exploding healthcare costs, and a generation of Americans who feel trapped in a maze of doctors, insurers, drug companies, food companies, and federal agencies. So, I am not interested in protecting the old system just because Washington insiders are comfortable with it. But I'm also not interested in blind loyalty. RFK Jr. and the Trump administration need to show results. Show us lower costs. Show us cleaner food standards. Show us stronger rural healthcare access. Show us less fraud. Show us less bureaucracy. Show us that reforms actually help the American citizen, not just create new slogans and new offices. Because patriots, we have been burned before. Washington loves naming things. They name bills. They name commissions. They name initiatives. They give speeches, print banners, hold hearings, and then somehow the same families still get crushed. So my message is simple. Codify the reforms, but make them real. Put American patients first. Put parents first. Put children first. Put seniors first. Put veterans first. Put taxpayers first. And stop letting lobbyists write the rules. If we're going to make America healthy again, then we need courage. Courage to confront Big Pharma when prices are abusive. Courage to confront big food when products are harmful. Courage to confront insurance companies when they deny care. Courage to confront hospitals when pricing is hidden. And yes, courage to confront federal agencies when they fail, waste money, or become captured by the industries they are supposed to regulate. That is the conservative position. Not weakness. Not surrender. Not blind trust in corporations. And not blind trust in government. Trust the American people. Give us truth. Give us transparency. Give us competition. Give us clean information. Give us accountability. Then let free citizens make informed choices. That is how a republic is supposed to work. So when RFK Jr. tells Congress this is a generational opportunity, I say he is right, but only if Congress has the backbone to do it properly. Don't turn this into another partisan circus. Don't use healthcare as a political weapon. Don't protect the broken system just because Trump is the one challenging it. And don't pretend the American people are too stupid to understand what is happening. We understand perfectly. We know our families are paying too much. We know our kids are being fed too much junk. We know the healthcare system is too complicated. We know lobbyists have too much power. And we know Washington has failed for decades. Now is the time to fix it. America cannot be strong if Americans are sick. America cannot be free if families are dependent on a broken system. America cannot be great if our children are being set up for a lifetime of disease before they even reach adulthood. So yes, Congress should codify lasting reform, but make it constitutional. Make it transparent. Make it measurable. Make it pro-family, pro-patient, pro-taxpayer, and pro-America. That's my reaction. Drop your thoughts in the comments. Do you trust Congress to turn this into real reform, or do you think Washington will water it down and protect the same old system? Stand for truth. Stand for freedom. Stand for America. God bless you, and God bless the United States of America.